We are out here talking about sun protection, and even on a day like this, you still need to be protected.
That's true.
Okay, and joining us now is Dr. Howard Brooks, a member of the American Academy of Dermatology and medical director of Skin, the Cosmetic Dermatological Center in Georgetown.
Correct. Right down
is
the
that
street. Right down the street.
Okay, because I tried to veer away, and I want to make sure we get all that right.
Sure.
Thanks for joining us on this Memorial
Thank you for
Day.
having me.
So, yeah, it doesn't look like it's sunny out here, but this is when you still need to make sure you have that SPF on,
That's
right?
true. That's true. I tell people to wear sunscreen every day, just like when they're brushing their teeth, brushing their hair. That should become part of their routine.
Okay.
Even on a cloudy day like today, if it's snowing, if it's raining.
And regardless of your complexion or your race, that's another one you probably want to bust down.
Absolutely.
Everybody needs it.
Everybody needs it. Actually, the plant guy just asked me, well, do I need to use it? Absolutely.
Right.
Everybody, no matter what your race, your complexion, we should all be using SPF every day.
Okay. And also, too, as we get older, that will also help, because we've seen how the sun can damage our face as far as wrinkles and making you look older.
That's true, and that's how I can scare patients into wearing sunscreen.
Right.
They don't care about the skin cancer, they just care about wrinkles. So.
And you brought us some products today to show, and one of them right there on the front, Neutrogena Smart Age Shield.
And that's why I brought this one. It says Age Shield, so again, I can tell patients, you may not be concerned about skin cancer, you may think that's too far away, but the sunscreen does protect from wrinkles.
And exactly what is SPF, doctor? We hear that, and we just, all those numbers, what does all that mean?
Correct. SPF just means how long you can stay out. The American Academy of Dermatology recommends that you use SPF 15 or above.
Okay.
A lot of times, this one says 45, there's even 70 on the market now. I mean, if you get it, as long as you're putting sunscreen on, that's great, but SPF 15 or 30 is fine.
What about for our kids?
Kids should be, you should wear sunscreen. Everybody should be wearing sunscreen every day. You want to really make sure that you apply it about 15 minutes before you're going out, and the key is to reapply, particularly during the summer months when we're sweating or if we're in the pool.
Right, and a lot of us look before we eat something out of the pantry at that expiration date for food, but there is also expiration date for medicines and
sunscreens.
Sunblock.
That's true. A lot of people go to Costco, myself included, you get the big huge tub of it and think it can last a year, 2, 3 years, so make sure you check that expiration date.
What is the difference between UVA and UVB protection, and is that in line with SPF? How does that figure?
SPF really just measures the UVB, and UVB is what causes tanning. So when you're getting that sunburn and you get that redness, that's UVB. UVA is what ages us. It goes down and destroys that collagen, destroys those elastic fibers.
I remember as a younger person, we put the baby oil on, and also one of those brands that has that wonderful coconut smell, but it seems that's only suntan lotion. It doesn't have the block in it.
Correct. So you want to make sure most of the products now say it protects you from UVA and UVB, and they're so cosmetically elegant now. For instance, the Neutrogena we just showed you it really is nice cosmetically. And
you brought some other products. We have about 30 seconds.
Okay.
Do those differ at any
I just brought this one just because it says, a lot of people still want that color. They want to get the tan, so why not use this self-tanning with the sunscreen in it? Okay.
And the sprays, too. That works out well, and if you're going in and out of the pool, it stays on.
It's nice if you're at the beach and you won't have to rub the sand all over you. You just spray it.
But still reapply. Okay. Dr. Howard Brooks, thanks so much for being here.
Thank you for having us.
Now, get out of that suit and go to the pool.
That's what I'm going to do.
If the pool's off. With sunscreen, he says. Back to you, Gavir.
Yes, carry the sunscreen with you.
Yeah.
All right, thanks, Al.